Hi, my name is David and I live in Chapel Hill.
So Dave, when you first came in here, what was your major complaint?
So I've had spinal stenosis at C5 and C6, and I had numbness that extended from my elbow to the first three fingers of my left hand.
Oh my gosh, and that had been going on for how long?
About 3 or 4 months.
Yeah, and you had actually lost some use in that arm too.
Yes,
Yeah, and so that's not good. And you used to do woodworking. Do you still do that?
I do.
Okay, and so now it's easier with both hands.
Indeed it is.
Okay. Yeah, and what sort of things had you tried to do to get this handled before you came here?
So I went through some fairly painful procedures to try and figure out what the problem was. The nerve conduction study. So they poked needles about 2 or 3 inches deep all the way from my neck all the way down to my hand and into this muscle here to identify where the problem occurred. It turns out I had what they call double crush, carpal tunnel, and the stenosis. So I got a cortisone shot here that made it a single crush. And then from there, I did the treatment with you, and I went from having numbness to, there's a little tiny bit of numbness right here, and that's it.
Wow. So, and then you're back to doing normal stuff? Yeah. And you had told me at one point, because I wrote it right down here, that you felt like you were walking on eggshells the whole time.
Yeah, I still haven't gone back to Brazilian Jiu-Jitsu, but I'm starting next Tuesday to take private lessons where I'm not going to have anybody crack my neck.
There we go.
Yeah.
And what did you just tell me a few minutes ago? What's your heaviest weight that you're lifting?
Right, so I bench press around 350 and I'm 59 in July. I was unable to do much lifting at that time, but I was able to get back to it within 6 months of starting this therapy.
All right, fantastic. Well, it sounds as though you would recommend spinal decompression therapy to others.
I would recommend it to anybody because the alternative, and the doctor, the neurosurgeon told me, you're a candidate for spinal fusion. But once you do that, there's no going back. It just made sense to give this a try, and turns out I was an excellent candidate. So you're gonna find out you need to stay hydrated. You're gonna have to do the exercises you're told to do. You're gonna have to show up for all your appointments. And if you listen to the good doctor, do what he tells you, you will regain use of your limbs.